Great rehab can make average surgery look pretty great. Bad rehab can take the best surgery and ruin it.
Today, we're diving into the world of orthopedic innovation from Dr. Kevin Stone, a game-changing expert who's transforming how we think about recovery. If you're frustrated with doctors telling you that an injury will prevent you from playing the sports you enjoy, you'll love Dr. Kevin Stone's book, Play Forever. He's dedicated to helping athletes and active individuals defy the odds and reclaim their passion for movement. With a career focused on innovative treatments and recovery strategies, Dr. Stone is here to share his expertise. We'll explore the latest advancements in orthopedic medicine, his groundbreaking work with biologic treatments, and how we can all learn to play forever right now. Dr. Stone, welcome to Forever Young.
Thank you.
Before we jump into how to bounce back from an injury, let's kind of rewind. What sparked your journey from doctor to superhero for athletes?
The athletes are the superheroes. I just get to help them along a little bit. But so as a young athlete playing soccer in college, I tore my knee joint meniscus like so many of your listeners have. And I admired the doctor who was cruising around the training room. And unfortunately, of course, surgically, he took out my meniscus cartilage, which is, again, a classic story that so many people have had over the years. But I really admired him looking at athletes and helping them get back to sports. And it just stimulated something in me that I thought I could maybe do someday. And then the story goes on because later on, when I was training with my mentor, a guy named Dick Stedman in Lake Tahoe, he looked at my bow legs and my missing meniscus and said, Kevin, if you could ever figure out how to replace the knee joint meniscus, you'd make a big contribution to orthopedics. And in my young Harvard arrogance, I flippantly said, sure, I'll do it. You pay for it. And that's how we got started in 1984.
Wow, I love this. It is interesting because you're right. Many of us suffer from meniscal tears. And I know Dr. Danielpour has had knee surgery from an injury early on in sports. And many of us now are looking, we're in our 50s. We approach playing sports a little differently. And, Dr. Danielpour and I have younger kids that we have to keep up with. And so sometimes it's a little challenging, and we're looking for all kinds of ways to help nurse us back to health so we can, continue enjoying our lives. And sports for us was something, just like we're not professional athletes, but just for a lot of males and females, it's, something that keeps youth. And so I definitely understand this. So let's talk recovery. If you're injured, we're saying don't hang up those running shoes just yet. How can we transform a setback into an incredible comeback?
Yeah, so all of us who play sports get injured. It's just part of the story. It's very unlikely that I ever see somebody who's made it through all of life without having one injury or another. The best people, in a sense, from an injury point of view, use their injury as an excuse to come back fitter, faster, and stronger than they've been in years. That's our job, is to help them do that. And so if they can see their injury as an opportunity rather than as, oh, bummer, I've injured my knee or I've injured my ankle and I'm out of sports for a while, we just try to turn that around immediately. Bummer that you've injured your knee or your ankle or your shoulder, the things that I treat the most. But let's bring to your day just what any professional athlete would bring to their day. Let's optimize your nutrition. Let's work on your upper body, your core, all the rest of the things that in the past people would go home and rest their knee or rest their joint, recover from a surgery and be somewhat debilitated. And now what we do is have people start their pro training program on day one after the injury or day one after surgery. And the better we do that, the better we convince our patients to see themselves as a pro athlete, even if they're not, the more successful we are at helping them come back and have a great journey.
I love that. A perfect example, we had a previous podcast with Charlotte Flair, who is probably the leading lady in WWE wrestling and followed her father, Ric Flair. And she had a debilitating injury, and you could see her train harder and faster. And she said the same thing. She used it as it was kind of a mental reset. in the beginning to say, you know what, I'm going to defy the odds. I will come back bigger, faster, stronger, fitter, faster, stronger. And she's about to, enter back on the scene and break even more records than she has before. Is there kind of a secret sauce to coming back, how to fitter, faster, and stronger after an injury? Or is this something, how do you necessarily set that mentality? I mean, I can just give an example. Let's say Aaron Rodgers played for the Jets, went down first game, with an Achilles. And a lot of people look at these injuries and say, well, never going to play again as well as you did before. Is there a trick to kind of setting that expectation and developing that mindset?
There are many. And it's a big part of our role as physicians. It's really, how can we help somebody see all the resources around them that they've maybe never seen before? So sure, if you're a pro athlete, you just go to the training room and you've got everything there to help you. If you're a normal person out there in the world, though, looking around and number one, working with your physician here at Stone Clinic in San Francisco, of course, we've got physical therapy and fitness trainers and nurses and everybody to help the athlete or the injured patient. But around you in the community, you also have all those resources too. They're invisible to you until all of a sudden you're hurt.
You're right.
So the first step is the mindset. Hey, bummer, I hurt my knee. I want to come back better. The second step is working with your physician and your rehab team so that you can design the program that, number one, helps your surgery heal better. And here's an expression. Great rehab can make average surgery look pretty great. Bad rehab can take the best surgery and ruin it. So it's really important you start out having that conversation with your doc and your training team saying, okay, listen, I might not look like Aaron Rodgers, but I can think like him and help me really raise my game to that level.
What key insights would you say from your book, Play Forever, can help listeners rethink their approach to recovery and staying active? I mean, obviously we have that mindset. You said bummer, but let's look at it a little differently. And we want to obviously work on having, the best possible team. What key insights can you offer from the book beyond that, that kind of retrain someone to, think about the recovery process differently?
So let's take that question and start back. How do we first help people not get injured? And then if they get injured, what can they learn from that injury? And so the first thing that we've learned, and I tried to explain in that book a little bit in different ways, is that most injuries are a result of a mental error. If you ask most athletes, they kind of know the moment before they got hurt, oh shoot, I shouldn't be in this position, or I shouldn't be going that fast, or I made this turn I knew I shouldn't have done, or I was landing awkwardly and I just tried to correct it the last second. And so if we can help people avoid the distractions, the cell phone, the girlfriend, the boyfriend, whatever, when they're in their game, when they're on the ski slope, when they're on the basketball court, just if they can be in the game, have their mind in the game, the errors that occur will really be diminished. So the first part is the mental training. Okay, you injured your knee or whatever. Let's think through why, and let's come back as a smarter athlete the next time. So part of that's mental training. It's, how do we quiet our mind? We all in the middle of the night wake up at 2 a.m. sometimes and the mind's going a mile a minute. And I'm sure all your listeners have that experience too. And you learn these techniques of, okay, how do I quiet my mind so I can go back to sleep? Well, how do I quiet my mind in the sport that I'm doing or the activity I'm doing? How do I use my injury, number one, mentally, to come back stronger? And then, of course, how do I optimize, who am I? Am I fit? Am I not fit? Am I overweight? Am I not overweight? Have I optimized my core strength? All the things that we can talk about that help you come back, reduce your injuries, and be better.
Let's say we fast forward to the future of orthopedic medicine, all right? Why are younger folks now opting for knee fixes? Are they onto something that, the general public isn't aware of?
So we're in what I call the anabolic era of orthopedics. And what that means is that we've learned, as many people in plastic surgery learned years ago and other aspects of surgery learned years ago, we can take the body's natural growth factors, blood, PRP, cells, and stimulate healing, actually accelerate healing. That's number one. And a lot of our research, and remember, I run a public nonprofit research foundation called stoneresearch.org. So I spent a lot of my life figuring out how to help people recover from surgery faster. Why does it take a year to come back from an ACL injury when we now have all these ways of stimulating healing? So the first part of it is this whole biologic era that we're now in. The second part of it is that we've gotten very good at identifying replacement tissues. So if you've lost your meniscus, like the story we opened up with, we can now put that meniscus back in. And we just published our data this year on patients over 50 who we put a meniscus cartilage back into their knees. They were all referred for partial or total knee replacement. They all sat there and said, "Hey, doc, isn't there just a shock absorber you can put in my knee? Help me buy some time. I don't care how long it lasts.
Of course.
I'm just not ready for my joint replacement," right? And so the data we published in 80 patients was that half of them delayed their knee surgery for 8 years. And the other half of them never came to that partial or total knee replacement in a 2 to 25-year outcome study. So we've gotten very good now at taking donor tissue, whether the meniscus or the ACL, and using it to rebuild patients' knees. The third part of this story that's fun to be in right now in the space of orthopedics is that bionics have made a real difference. So let me explain. The first half of my career, I did partial and total knee replacements with saws and guides, the way they traditionally are. In the second half of my career, I bought the first outpatient robot, and I learned how to use it so that I realized I was nowhere near as good as I thought I was. The robot shows you how phenomenally precise you can be and remove much less bone, use implants that the body can grow into the implant, so we get rid of the cement. And that's what opened the door to our patients with severe arthritis to have partial and total knee replacements and then come back to running and skiing and hiking and climbing. So the three areas, the anabolic era that I think we learned from other specialties, dentistry, plastic surgery, all the folks who are using tissue grafts to help healing, the tissue replacement space, and then the bionic space has really changed what we do now, which is why almost everybody who comes in with one type of injury or another, we can set a goal with them. We can partner with them to say, okay, what sport do you want to come back to? And let's design a program to get you there. And that's the fun of what we do.
I found your book to be fascinating, and here's the book, Play Forever, which if you talk to most orthopedic surgeons, most of them will tell you once you hit the age of 40, you're done. Don't play any team sports, don't play basketball, don't play football, don't do anything where someone else can get you hurt. And these are a bunch of my friends that have said this. And it's interesting because it's happened when you get on the basketball court and that 43-year-old just jumps and comes down and pops an Achilles. Or, they're playing volleyball on the beach and they hurt their shoulder. And I could give you 1,000 different examples. But my question is, there's a chapter in your book that talks about regenerative medicine. And I'm very fascinated, and I hear, things that are all over the place, from injecting partial tears with stem cells that'll make them heal back. If you've got a partial Achilles, just PRP will help. What are your thoughts? I know you've done a lot of research on this, and I know you use some of it. What are your thoughts, and where is the limit? Where is it where you have to draw the line and be like, okay, this won't really help you?
If I understand what you guys do well enough, you guys are in the business of making people look better, and I'm in the business of making people be better. And so together...
Absolutely.
Synergy.
Yeah. Together, what are we doing to try to achieve those goals for people at all ages? And what we're fundamentally doing, although we didn't really realize it, is that we're mobilizing the patient's own regenerative ability to repair their tissues. We're helping them. But essentially, we can help them all we want to, but if they don't have the healing power or they don't mobilize it, then they won't succeed. So let me explain. So over the last 10 to 15 years, many doctors were injecting cells, bone marrow cells, fat cells, cells grown up in tissue culture, thinking that those extraneous cells would heal or accelerate healing. And what we've learned over the last bit of time now is that every patient, young and old, have billions of stem cells within their body. Yes, younger people have more, but even so, you wouldn't be alive today. You wouldn't heal your cut or your fractured bone or anything else unless you had, without all those stem cells. So where our research is, and where I think the field is going to, is how can we be better at mobilizing the body's own, the patient's own stem cells to get to that site of injury or that site of repair or that site of anything that we've helped them with in order to augment their healing. So much of the research now is on chemotactic factors, factors that induce the body's own stem cells and other cells to migrate to the site of injury and mobilize that healing response. And the better we get at that, the faster we will both accelerate healing and regenerate tissues. The second part of that story is the salamander story that I think you were about to refer to there with, hey, listen, if salamanders can regenerate their tail, if children who cut off the fingers, the tips of the fingers can regenerate their fingertips, clearly within our DNA lies the ability to instruct cells in our body to regrow tissue. And so our job is to figure out, number one, how do we unlock that sort of hidden or suppressed DNA components, number one. Number two, how do we mobilize the cells that are already there? And we're getting better and better at it. It affects plastic surgery, it affects orthopedic surgery, it affects everything where we're trying to help tissues heal better, be younger, look younger. And that's the aspect of the longevity space that I'm so excited about, because I think we don't have to look too far. It's really within the patient. We just have to be better at it.
Staying along that same vein, when we talk about the potential that the body has, what are your thoughts on the ability of those cells as we age to repair? Again, we look at a child being able to grow back a fingertip, and we look at some of these things where it's easier to heal when you have fully functioning cells. As we age, I think we lose, number and function of certain aspects of these stem cells or signaling cells. Some of these have been improperly named, but, I wonder, is there a role for introducing these younger cells, or do you fully believe that, the body can heal itself?
Yeah, I think we've been disappointed with when we try to introduce cells into a body. Most of them, unfortunately, die or leave or aren't around long enough. The healing process within humans and all animals is much more like your grandmother's chicken soup. You need to have all the components, and you need to have them interact with each other at just the right time. So certain factors are what we call pro-inflammatory. They stimulate inflammation. And other factors are anti-inflammatory. But in fact, you need the pro-inflammatory part to kick off the healing process. You need the anti-inflammatory part to not let it go too far. But some things only go partway, where you need more stimulation at a different time in the healing process. So it's a phenomenal dance of how do you have that whole chicken soup. So we're not confident that injecting younger cells will do that, but we are confident that the body does know how, and we can get better and better at working with those cells and working with that whole milieu inside the patient to get to where we want to go. Now, I may be dead wrong about that. It could be that younger cells are the answer. And let me give you an example in our own research where we're optimistic about just the opposite of what I just said. So we did a prospective, double-blind, randomized study when we injected into patients came in with arthritic knees. And we took out a little bit of fluid from their knee and analyzed all the factors in that knee. And then we gave them one of four options: a control of saline, hyaluronic acid, the natural lubricant of the joints and actually used in plastic surgery too as well, hyaluronic acid and PRP, or the natural stimulant from their own blood, or a combination with amniotic fluid and birth tissues. It turns out that when you add the anabolics from young healthy tissue, you extend the length of pain relief in those arthritic knees out to 18 months. And why does that happen? Well, let me explain that story a little bit. So young healthy fetal tissue, which is obtained from young healthy mothers at the time of C-section. So they come for a normal birth, they have a C-section, all those tissues are thrown away, tossed in the garbage. And so instead of tossing them into the garbage, they send them off to the tissue bank. And the tissue bank can extract Wharton's jelly or amniotic fluid or membranes. And that stuff is rich. That may be the fountain of youth right there. The reason the mother doesn't reject the fetus in utero, even though the fetus is only one half the mom, is because those cells are immunomodulatory. They shut down the rejection response. And they obviously are pro-anabolic. They help the fetus grow. Nothing's growing faster than the fetus in a healthy way. And so our job is to take those young, healthy birth tissues, Wharton's jelly is a very common one right now, and see if we can use them to augment this healing response. Now, the FDA has limited some of that work, but I believe that will be one source of young, healthy tissue that augments our ability to mobilize the body's own cells and do the repair process that we want to do. So on one hand, I believe in the patient's own ability to regenerate and to heal. On the other hand, I know that we will have better tools as we move forward.
Love it. Are you able to tell us, I'd love to hear about some, incredible success stories. I know that one of your patients, I believe the name Richard Donovan, ran 3,200 miles across America over 3 months after 2 partial knee replacements. Can you really run after a knee replacement?
Yeah, that wasn't all he did. He ran 7 marathons on 7 continents in 7 days as well.
Wow.
So the guy's got good ability. So many of your listeners have been told, hey, if you have a partial joint replacement or a total joint replacement, you can't go back to running or impact sports. And we thought about that for years and realized that when you tell people to go home and not do impact sports, their muscles get weak and their bone gets weak. That's the osteoporosis that affects all of us as we age, women faster than men. And the only really good way to build bone is resistance exercise. All the drugs and all the other things help, but the best way is resistance exercise. So we realized that if you're telling people to go home and not do things, the loosening that we saw in those joints would accelerate rather than decrease. And so I went to meetings over the years and said, hey, everybody, all total joint surgeons, raise your hand if you've ever seen a joint replacement knocked loose from sports. And nobody ever raised their hands, but they've been telling people for decades not to play sports. The second part of the story that changed a lot is that when we achieved robotics, we could make a 3D model of patients' knees and put these implants on their knee and not use cement because the precision of the cutting permitted the bone to grow into the implant. So now it was fixed and they weren't going to knock it loose unless they broke their leg. So there was no real reason to tell people not to run or not to do impact sports if we could do these, perfectly done uncemented total joint replacements. So that's what we did. And we extended that as well to our partial joint replacements where we still have to use cement. But we learned that if we increase somebody's exercise rather than decrease their exercise, they build their bone and build their muscle. So for now, the last 15 years or so, we've been pushing people to do more exercise, not less. We haven't seen anybody knock their implant loose or wear it out from increased activity. And we're big proponents of really do much more, become a fitter athlete after your joint replacement rather than a less fit one.
I love the fact with 3D printing, how precise we can get. I mean, there's been multiple different types of surgeries where they preemptively create a model, the conjoined twins where they're taking apart brain and some of the very delicate tissues. When we look at facial mapping for face transplants and, all the different things that can be done, I use it, believe it or not, in rhinoplasty for postoperative splinting. We create 3 custom splints and, but it's so interesting to me that now our implants that were really, not one size fits all, but you'd have a small, medium, large, and you'd have to cut the bone in order to fit it correctly. Now you, as you said, you create this perfect, precise implant that, your body can grow into.
Actually,
it's just phenomenal.
Let me clarify that for a minute, because what we're doing is 3D modeling. So we are modeling that patient's knee, and we are using standard size implants. The effort to make the effort to make 3D printed metal implants as opposed to 3D printed other materials like you might use in facial surgery didn't work out so well. And let me explain why. If you make something out of metal 10,000 times, your error rate in the metal processing of that implant is going to be very low. If you make something out of metal, even 3D perfectly printed, only once, your error rate in that manufacturing process is going to be very high relative to the one that you made 10,000 times. And so it turned out in knee replacement, it was better to do a 3D model of the knee and then take away the least amount of bone possible to match that cap. And that's what's worked out so well in the knee joint. We are and are hopeful about 3D printing and a host of other implants in the body, especially in orthopedics. But for most of the things where you have to use metal and plastic, we're not quite there yet.
I'm imagining that as technology gets better and better, that maybe that will be a possibility with less error rate. But even the preoperative planning, I mean, I think that 3D modeling is just, it can be crucial for many different surgeries. So, the other thing that, in talking to some of the regenerative guys, they are looking at building a hydrogel scaffolding with built-in stem cells, so it's almost like these extended release tabs that we take where over time. What are your thoughts on, even if you were to use your own body, what are the thoughts that the body can regenerate cartilage? So if we talk about the different options, what are your thoughts?
So it's a very timely question for us because we received a $1.1 million grant from the California Institute of Regenerative Medicine last year to take a hydrogel and take our paste graft technique and merge them with stem cells and see if we could regrow cartilage better than the technique we've been using for the last 30 years. So let me explain. So if you come to me with a cartilage injury or arthritis and there's still joint space, one of the conversations we're going to have is, should we regrow your own articular cartilage and replace your meniscus? Or should we do something bionic, put in metal or plastic? And it depends on a host of factors, which is why I have to examine the patient before I advise them. Finally, I can advise them by MRI and X-ray and conversation virtually, but the best thing is always an exam. So with that grant, we have now done rabbits and goats and are about to do horses in 2 weeks on adding hydrogels to stem cells to the patient's own bone and cartilage in a mixture called a paste. And one of the reasons why we do this in horses is because horses and dogs get the same cartilage injuries that humans get. And very valuable horses and very highly trained dogs are extremely valuable animals, and we love them too. And so if we can create a cartilage repair model for their joints, it would be a big contribution in veterinary medicine as well as in human medicine. So we do believe that augmenting hydrogels with cells is a good way to go. We think right now we can do that with the patient's own cells, but it could be going forward that you take them out of the freezer and they work just as well. We just don't know yet.
It's interesting. You bring up patient's own cells, and in the book, you really have a great area where you break down the different types of cells that can be used for regenerative medicine. And it's really nicely done, especially for the layperson that doesn't understand any of it. When you say the patient's own cells, what cells are you using for the scaffold?
So right now we're using their bone marrow cells. And so bone marrow has stem cells within it, as do almost all the tissues in the body. We're finally learning, by the way. But it's easier to get a higher concentration from bone marrow. So we can use either bone marrow cells, or in the horse case, we can actually use horse stem cells that have been recreated and grown in culture. So the field isn't yet settled on where you take the cells from. However, as you know, we're all regulated by the FDA, at least on the human side, and the veterinary side is regulation as well. And so we have to think through what's the most logical, least expensive, likely to succeed pathway for stimulating the repair materials and tissues that we want to put in a patient. And my intuition is that if we can find, whether it's hydrogels or paste of their own bone and cartilage or whatever, and augment it with a patient's own cells done at the time of surgery in the OR or in your clinic, your path through the FDA is probably going to be a lot faster and probably less expensive for the patient, and maybe likely to be more effective.
And there's also something else that I found full chapter on that I thought really kind of falls into the same world as plastic surgery. We love prevention here. We find preventing wrinkles or preventing sagging skin or preventing, age spots are the way to go, because then you don't have to treat them. And I saw that you really have a big area in this book, and I think it's really the name of your game is prevention. Tell us, if you can, for some of our younger and older listeners, how can we avoid all of the injuries and the setbacks that we all have over the years? And what's your one simple tip that listeners can start today to protect their joints and keep playing forever?
The simplest tip is to get rid of the word working out. Nobody likes to go work. We want to go play out. And so design a way that you exercise in some form or another 7 days a week. And the reason why it's 7 days a week is that you become addicted to that. You become addicted to the testosterone, the endorphins, the pheromones, all the stuff that flows through your body and makes you happy. And if you start out doing it 7 days a week, if you miss a day, you feel bad. And you, oh man, I need to get out there and go do whatever it is you love to do. That's number one. Number two, make sure it's fun. Because if it's not fun, you're just not going to really want to go do it. Number three, do it with other people. It's stunning how much more you get out of playing, both psychologically and physically, when you can find a gang to do it with, or a friend to do it with, or a trainer, or anybody. Just find somebody that you can play with very often and do something every day of the week. And if you do that, your mindset is a very athletic, physical, healthy mindset. And so you're going to get the injuries that we all get. It's just life. But you're going to come back to them because you see yourself as we want you to see yourself as an athlete in training, not a patient in rehab. And so if you have an injury, or if you have a surgery, or if you have something that needs to be fixed, it's one little setback at one part of your body, but all the rest of your body is available to you, and your mind's available to you with that addiction of getting out there and playing out. So a little bit of a longer answer than my simple answer for you, but I think you get it, that turn life into sport and play out every day.
And I assume that, nutrition and hydration are as important as the mindset and the activity as well, right?
For sure. I have to tell you, though, that nutrition is absolutely the worst science of all the sciences we all deal with. And it's because it's so hard to do good research in the nutrition space. It's really hard to know even what one person who's trying to control their diet actually eats in a day. And so we're weak in the nutrition counseling. We use generalized advice. Hey, eat what grows in the ground. Try to diminish processed foods. Drink much more water than you think you should. And make water as your go-to beverage all the time. Just, try to optimize food as your fuel. So as you're playing out a lot, balance between how much you're playing, how hard you're going, and how much fuel you need to do that well and to build your body and your health. And if you think that way, fairly simply, about food as fuel, water's your go-to beverage, eating natural things that are growing in the ground most often, you'll probably have a reasonable diet. If you're trying to lose weight to optimize your mechanics and your body and your diet, then there's a whole host of people with expertise in that space, which isn't me. But I think this era of peptides is going to dramatically change everyone's ability to optimize their weight. And I think it's a space that we can get into another time. But, all the GLP drugs that you're hearing about, there's a lot of science around using them at 1/10 the dose, so that people will use them for targeted periods of time, for 6 months, to just optimize their body and their weight, and then not be on them for a lifetime, and also not lose a lot of muscle the way, if they take the full dose, people tend to lose when they lose 30 or 40 pounds in a few months. So that science is just coming along, and we'll get better and better at it. But I think your patients, all of our patients, will have tools for optimizing their body that they never had before.
I also read somewhere that you were a big athlete, and I assume you still are. What sports are you still playing?
So it's seasonal. And on that point, so here I live in Mill Valley and work in San Francisco, so I get to take my boat to work. And so on the way home, depending on which of my children call me, We may water ski or e-foil or get on the water. In May till October, we windsurf here. We bike year round. So we're always playing. And I do something every day. And
Love it.
we live in bike heaven, so that we're on the side of a mountain. So we're on our bikes whenever we can be. And just always trying to do something every day that puts a smile on my face. And I think that's the way to go. And I, like all my patients, just feel bad when I miss that day.
If there's one myth about injury recovery you wish you could bust wide open, what would it be? It's interesting. We had a previous podcast, and it was the lies I was taught in medical school. And essentially, so many of the dogmatic ideas that we've had that have been pervasive in medical education now are slowly shifting. And, I think with recovery, it was ice, rest, elevation. But I think what you've been saying this whole time is that, look, we want to get back into it. Obviously, some of those things are important, but, I'm imagining that early activity for you is probably something you prescribe.
Yeah. So all of our patients who go to surgery come back to our clinic day one after surgery to work with our fitness team and physical therapists for 2 hours a day. And depending on where they've flown in from or how long they'll stay with us, if they'll stay 3 months, if they'll stay a week, they're here every day post-op. So I think the best one, if you were to summarize it in one, is we've learned how to optimize relative rest. And so if you need to protect a joint or a part of your face or something that's been injured and repaired in your field, learning how to do that relatively, meaning protect the operating site and train all the rest of you on day one after surgery, you're going to have a much better journey through it. The next part of it, I think, is that try to make your medical team, your fitness team, a lifelong team. We love it when our patients become patients for life. Not that they need much of my care, but they come in and work out with our rehab team. We get to see how fit they are, how things are going, and tune their program and get them ready for ski season or whichever season they're getting ready for. And the ability to stay engaged with the people who are caring for you. We don't just care about you the moment we're trying to fix you. We're trying to help you live a long time and drop dead at age 100 playing the sport you love. And if we're going to do that, that means we stay in touch. We have a lifelong relationship. And the ability to try to do that and create that with your care team, no matter what aspect of your body they're caring for, makes it a much more fun experience and more rewarding for us as on the care side and for the patient as well.
Listen, I've learned a ton here. I know our viewers and listeners have. If someone they were looking for more information, obviously, the Play Forever is fantastic. And I'm imagining that you can pick it up at any store, or you may look at it on Amazon. What information can people search for, or where would you direct them to if they had further questions, they needed to learn more?
Sure. So there are three things. Number one, a big part of my mission is teaching. And so I write a blog each week that we publish on Sundays. And I won't take any of your time unless it's a gift of education. So it's trying to teach about some topic or another. Number two, at Stone Clinic here in San Francisco, we have a busy website that we're trying to put patient stories on and what we've learned from our patients. And quite frankly, I learned the most from my patients who cheat. It's the patients who taught me how hard we can go or things I didn't think were possible. And so we try to tell their stories there as well. And number three, I wear the hat of a public nonprofit research foundation. So stoneresearch.org is our public research foundation. A lot of the research that we do is published there, and come get involved in that and help push that along. And we help people, again, trying to stay active forever.
If you like this video, you're going to love this one.
He was kind of like the pioneer in the field, right? He did it for Tiger Woods, A-Rod, like all those big people. And he kind of started doing it for sports injuries. And then obviously people started using it for cosmetics and so many other applications.